Restrictive cardiomyopathy is a heart muscle disease characterized by the stiffening of the ventricles, which leads to impaired diastolic filling. Unlike other forms of cardiomyopathy, such as dilated or hypertrophic cardiomyopathy, restrictive cardiomyopathy primarily affects the compliance of the heart walls, resulting in a rigid myocardium that restricts the heart's ability to expand and fill with blood during diastole. Normally, when blood fills the ventricles, they are compliant, meaning they stretch and allow more blood to fill in. However, in restrictive cardiomyopathy, the ventricles become stiff and cannot expand properly. This means less blood fills into the ventricles. As a result, the heart cannot pump out enough blood to the body, leading to diastolic heart failure since the filling problem occurs during the ventricular relaxation phase. Restrictive cardiomyopathy can be classified into primary and secondary types. The primary form often has no clear cause and is called idiopathic. Secondary restrictive cardiomyopathy is typically caused by conditions where infiltration of abnormal substances in the myocardium, such as amyloidosis due to accumulation of misfolded proteins, hemochromatosis due to excess iron deposition, and sarcoidosis due to formation of granulomas in the heart. Additionally, endocardial diseases like endocardial fibroelastosis, where fibrosis develops in the lining of the heart and subendocardium, and Loeffler's endocarditis due to eosinophilic infiltration causing tissue damage and fibrosis, can also lead to restrictive cardiomyopathy. Scleroderma and radiation therapy-induced heart tissue damage can also result in the stiffening of the myocardium. In restrictive cardiomyopathy, echocardiography shows normal-sized ventricles with impaired filling during diastole and enlarged atria. Cardiac MRI is useful for detailed imaging and detecting infiltrative diseases, while an endomyocardial biopsy helps to find specific causes like amyloidosis. An ECG may reveal low QRS voltage, atrial enlargement, or conduction abnormalities. Treatment aims to manage symptoms and address the underlying cause of restrictive cardiomyopathy. In severe cases where other treatments fail, a heart transplant may be necessary as a definitive treatment option.